Hey everybody, how's it going? Here we are again. I was recording this and my laptop died right in the middle, so let's redo it. But welcome back to another stream of self massage and stretch. And today we'll be going over an old stream that I did as one of my first episodes. And now we're at episode 23, so come a long way. And I decided it'd be good to do a little revamp for sciatica pain. So today's topic is solving sciatica pain. And yeah, let's go ahead and start with the basics about sciatica. So sciatica could be caused by an injury or a nerve compression. It's typically misdiagnosed, so a lot of people think just their normal lower back pain is a result of the sciatica pain, but it could be lots of other things, at least like 10 to 20 different things other than sciatica could cause lower back pain. But what are the causes of sciatica pain? So the main cause would be more of a spinal cause, so you have some sort of disc issue like spinal stenosis or a herniated or bulging disc or a lumbar spine injury or injury directly to the nerve because of surgery or uh, blunt force trauma. So those are more of the common causes of sciatica pain. And the more uncommon ones are the non-spinal causes like piriformis syndrome and things that are more muscular. But yeah, the symptoms of sciatica can include radicular pain, so pain that radiates all the way from the lower back down to the foot through the nerve pathway or any area that the nerve innervates. So most of the leg muscles and foot muscles. And then it can also cause a sensory impairment such as a hot and cold sensation or tingling and numbness. And you can also get muscle weakness. So just without pain, you might feel weaker than normal. You could have a gait dysfunction where your walking posture feels slightly off. And yeah, it could also cause a impairment of reflexes. Sorry, I'm kind of glitching out. I don't know why, but okay, it's better. But yeah, it gets worse with age, poor health due to either like chronic smoking or chronic depression or obesity, and also could be caused by an increase in physical activity more than you normally would do. And so, how do we prevent sciatica pain? Here's how. First thing you need to do is assess and make sure you know exactly, or more specifically, where your sciatica pain is coming from. So, the way to test for true sciatica pain is to do the straight leg raise test. So, to perform this, you're going to lay down somewhere, lay down flat, and then you're just going to raise your leg up straight at least 45 degrees. So, as far as you can go. And if you feel any pain during that test beyond 45 degrees, uh, you have true sciatica. And a way to test for more of the non-spinal causes would be to assess your hip mobility passively. So I'm going to show you how to test your hip rotation passively. So you're going to lay down again. This time you're going to bring one leg up like this. You're going to let it fall out to the side as far as it can go. And notice if you feel any pain or tightness in the lower back. And then bring it up and all the way over to the other side as far as it can go without your butt coming off. So yeah, you should get about 45 degrees there, both ways at least, for optimal hip mobility. But if you don't, then that could also be one of the causes. And And let's go ahead and jump in to the self massage portion. So, one of the most common areas that people need a massage for sciatica pain is the piriformis muscle. So, I'm going to show you guys how to do that very easily. You can do it sitting at your desk while you're working. So, literally, take a little lacrosse ball or a tennis ball or any sort of round or kind of hard object that you could sit on comfortably without tearing your pants or something. And you're going to sit on it directly where you feel the sit bone. So place it right under that sit bone. And what you're going to want to do is you're going to start to slide across the seat sideways so that the ball rolls towards the outside edge of your glute muscle. So this is a little easier when you have a bigger ball, but do what you can, and you're just gonna slide across, and I'll go ahead and show you what that looks like. So I have this ball, I've placed it right under my sit bone like this, and then putting pressure in there, I'm gonna slide away side to side until I feel that pressure in my glute muscle. So it's really important to go side to side with this one. And you can go ahead and deepen it by crossing your leg over so that the ball is still there and you're just rolling side to side to be able to release the piriformis, because it won't release if you're going up and down. So if you do that for about a minute or two, you'll definitely feel way less tightness and pain in your lower back. And then also I want to show you another quick one you can do for your hip flexor, because the psoas muscle attaches near where the sciatic nerve starts, so it can also contribute to some of the irritation of the nerve if it's tight or underactive. So what you're going to do is find your hip bones here that stick out. You're going to go about 1 inch towards the middle, and you're going to start with one side, press in there pretty firmly, and just work on raising your knee up and down while maintaining pressure there. So you can do this sitting at your desk also. But this will help to loosen up your psoas muscle and get your hip range of motion back. And go ahead and try that and see how you like it. Then the next thing we want to do is for the stretch therapy. And you don't actually want to stretch if you have sciatic pain, because stretching may cause further irritation based on how far you lengthen the muscle or nerve fibers. So what you want to do is more of a nerve flossing technique to help create more movement where the nerve is stuck. So with this one, you can do sitting up in your chair as well. But what you're going to do essentially is you're just going to straighten and bend your knee while keeping your leg up off the floor while sitting in your chair. And then you're going to also link your head movement with your foot movement. So as I'm kicking my leg out like this, I'm going to move my head forward. And then as I'm bringing the leg back, I'm going to tilt my head all the way back. So I could kind of show you a full range like this. And that's how you floss the sciatic nerve. So do that 3 to 5 repetitions, at least 2 or 3 sets of that twice a day if you have sciatica pain. And now we'll get into the qigong portion. So this is from the 5 Animal Frolics qigong series. This is the deer, or shake your antlers like a deer movement. So let me space. It's pretty simple. There's a couple arm movements. So basically, what you want to imagine is that a baby is falling out of the sky and you're going to catch the baby. And then you're going to safely drop the baby onto a bed of grass. And then repeat that going in the other direction. So you bring your hands up, catch a baby, place it safely on the grass. And what you're basically doing is you're starting with the outside hand, and then the inside hand kind of follows and takes the lead. It takes the follow as the outside hand takes the lead. There we go. So they're moving in sync, but one is starting before the other. And as you notice, there's one hand remaining towards the center to maintain balance. So go ahead and start with this arm movement. You can do it on one side at a time, just practicing going in a circle, if that's easier. Just to get the flow of the movement. And then as you notice me moving my arms, I'm also rotating my body naturally to go with the flow of the movement. So you might feel that you need to rotate somewhat and just let your body flow the way it needs to. So yeah, once you get the arm movement down, you're going to want to do the footwork as well. So it'll look like this. So as I'm stepping forward, the arms come out and then drop down. And then I switch legs and perform the same movement. Like this. Okay. And go ahead and do this for about a minute or two to help loosen up the compression on your sciatic nerve. And see how it helps. So that's a little bit of qigong for you. And next we'll get into Tai Chi move. Real quick, I want to show you how to do it. It's a standing posture. So basically you're going to just take a split stance with one leg in front of the other, kind of as if you're playing baseball. And you're going to keep your hips square so that your hip joints are facing forward with your toes facing forward too, instead of being sideways like a baseball hitter. So it's a little different, but now you're able to put more of your weight in the front leg and bend your knees a little bit to create a stable position here. And then what you want to do is whatever leg is in front, that arm is going to be bent in front like this, and the opposite arm will be placed as if you're resting it on a table like this. So this is a standing posture you should practice to help activate your glute muscle and also improve the function of your glute activation during a functional movement such as standing or lunging or crouching. So this will really help with sciatica pain. And I'll show you how it looks on the other side so you can see. Okay. And one last thing to show you physically is the yoga therapy part. So for this part I chose the downward dog with a straight leg raise. So the reason why this one would be good for sciatica pain is because you're working on loading the opposite glute of the leg you're working on during a lengthened position, and also working through hip flexion and range of motion and hip extension. So it's more of a dynamic downward dog, but it'll help. So you're gonna start in a push-up position like this and push your hips back using your arms so that you engage your lats. And then you're gonna raise one leg up as far back as it goes. And then you're gonna let it come and try to bend your knee all the way up towards your chest, while maintaining the posture here. And then you're just gonna repeat that 5 to 10 times on each side. And that's a good yoga pose for sciatica pain, if you can perform it. If not, then I would modify it by laying on your back and just working on bending and straightening your knee. And so I always love to end my streams with a little meditation because it's scientifically proven to reduce your perception of pain. So please take a minute to just close your eyes for a sec and tune in to the inside part of who you are. So let's tune into our sensations, our breath, the way our body feels, how tense our muscles feel. Let go of it all, fix your posture, and close your eyes and take a deep breath and pick whatever breathing pattern you like, as long as it relaxes you. And now just focus on being present with where you are and what you're doing. So we're here sitting and meditating, and anything else that may come into your mind, you can just notice and come back to that space that you first were at. Go ahead and keep meditating. Alright, and then you can slowly open your eyes whenever you're ready. Hopefully you're all nice and relaxed and loosened up. And we're going to end with a little bit of sound healing. So I always like to end with the heart chakra frequency. So hopefully you can feel it. You might not hear it, but this will really help with any sort of emotional imbalance or heart chakra imbalance or blockage. So hopefully you can hear it. Well, thank you all so much for tuning in to episode 23 of Self Massage and Stretch. And thanks Frank and Ashley for joining. I've been going for about 20 minutes now, so I need to put a cap on it, and I'll upload it to my YouTube and Instagram So you could follow me on there. I'll type in my username for Instagram. And then on YouTube, you just search Mystic Massage and Wellness, and it'll come up. But yeah, you guys have any questions about anything? Someone says I just need a massage. Well, hey, you definitely could use one, and if you like this video, then you can book an appointment here at this link that I'll type here if you're local to Long Beach, or you can book on my Instagram. I also do online sessions for pain relief, and yeah, we'll fix you up. But yeah, any other questions or anything? Well, thanks for the compliments, guys. I'm gonna have to end the stream and gotta get ready for my next session. So have a great day, and please join in on the next one.